Good afternoon, everyone. My name is Siwakorn Rattanakuntee, a master's degree student at Department of Oral and Maxillofacial Surgery, Faculty of Dentistry, Chiang Mai University, Thailand. My presentation will be about correlation between O-GlcNAcylation and expression of OGT and OGA in postoperative osteosarcoma chemotherapy. Osteosarcoma is an aggressive malignancy of mesenchymal cells. It is a primary malignant bone tumor that common in children and young adults and usually occur in metaphysis of long bone. Nowadays, we know that osteosarcoma has very complex genomic background, and the etiology of osteosarcoma is still unclear. From this bar chart, you can see that the progress in Northern England and West Midlands in the last 70 years in terms of 5-year survival rate. The survival rate have been stable since 1980s. That is not very surprising because we have been using the same drug since then. The current treatment for osteosarcoma normally starts with neoadjuvant chemotherapy, then followed by surgical removal of the primary tumor and the additional adjuvant chemotherapy. According to the American Cancer Society, they divide the patient into 3 groups, which are localized, regional, and distant stage. 5-year survival rate of osteosarcoma in patients who was diagnosed in 2008 to 2014. Localized state has the highest survival rate, about 77%. Distant state has the lowest survival rate, about 27%, and the overall average is about 60%. The survival rate of osteosarcoma has significantly increasing due to the combination of the chemotherapy and surgical treatment since 1970. Nevertheless, during 30 years after that, there was no improvement of survival rate at all. According to this graph, you can see that from 2000 to 2010, the survival probability is higher than in 1990 to 1999, but not significantly. And the study of Mirabello et al. In 2009, which using US patient database from the surveillance epidemiology and the end results program database from 1973 to 2004, the study report there was no significant improvement of survival rate. O-GlcNAcylation is a post-translation modification of protein by addition of an acetylglucosamine to hydroxyl group of protein. By this process, using UDP-GlcNAc as a substrate by O-GlcNAc transferase and to removal of O-GlcNAc from protein by O-GlcNAcylase. This process is like a switch to turn the activity of protein to make protein substrate active. Many O-GlcNAcylated proteins play a significant role in intracellular signal regulation, such as nutritional response and transcription regulation. UDP-GlcNAc is an end product of the Hexosemian biosynthesis pathway. After this slide, I will use OGT for O-GlcNAc transferase, OGA for O-GlcNAcylase, and HBP for Hexosemian biosynthesis pathway. So what is the HBP pathway? Hexosemian biosynthesis pathway is one of the glucose metabolic pathway. About 2 to 5% of glucose is imported into cells, and glutamine donates amino group to form the glucosamine 6-phosphate. Finally, uridine 5-diphosphate is phosphorylase to create UDP-GlcNAc and go to O-GlcNAcylation process. From this cascade, you can see that glutamine and glucose have an important role in this pathway. So if cells have a lot of glutamine and glucose, so UDP-GlcNAc will be increased as well. In several studies show that level of glutamine and the glucose was significantly higher in cancer cells compared with the normal cell. So we have that O-GlcNAcylation level in cancer cell will be higher too. Many previous studies present association of O-GlcNAc with many types of cancer. For example, in 2015, Chayawat et al. Report increases of O-GlcNAcylation, OCT, OGA in 2010 of colorectal cell cancer cell line. And most of the study is represented in epithelial cells origin, but not commonly in mesenchymal cell origin. Our previous study suggests that OGT play an important role in the chemotherapeutic response of osteosarcoma cells, with significantly higher levels of OGT in osteosarcoma patients who respond too poorly to chemotherapy, while level of OGT related to survival time of osteosarcoma too. This objective of this study is to explore the expression of OGT, OGA, and level of O-GlcNAc in 20 osseous specimens that was diagnosed as osteosarcoma using immunohistochemistry protocol before and after adjuvant chemotherapy. 20 formalin-fixed polyethylene-embedded osseous specimens were obtained from osteosarcoma patients who has treated and diagnosed between 1999 and 2020 at the Department of Orthopedic Surgery, Rattanakuntee Hospital, Thailand. All the patients received standard treatment, including surgical tumor resection followed by neoadjuvant chemotherapy. Tumor staging was classified following Enigin classification in 1980s. Each 3 micrometers osseous specimen section was detected using a Ventana automated scanner and ultra-view universal DAB detection kit. The osseous specimen section were incubated with anti-OGT, anti-OGA, and anti-O-GlcNAc for 32 minutes at room temperatures. This picture shows the positive control that are derived from breast, lung, and colon cancers. First, we oriented using bifield microscope at 10 times magnificent powers, and then 3 images of each section were scoring by 40 times magnificent powers. The immunohistochemical scoring is the multiplication of percentage of positive cells and the intensity. This score was modified from Formalin standard in 1987. Statistical analysis was performed using graph trapezium version 9. We compared the IRS score between pre-treatment specimen and post-chemotherapeutic treatment specimen using the Wilcoxon pair silent test. Next, we move to the result of our study. In our study, we have 2 main results. The first result is levels of O-GlcNAcylation decreased in post-chemotherapeutic tumor. From this bar graph, it significantly shows a reduction of O-GlcNAcylation in the post-chemotherapeutic osteosarcoma specimen. The second result is reduction of O-GlcNAcylation in post-chemotherapeutic specimens associated with tendency of low OGT expression but high OGA expression. This bar graph represents a reduction of OGT in the post-chemotherapeutic osteosarcoma specimen, but not significantly. Also, the elevation of OGA in the post-chemotherapeutic osteosarcoma specimen is not significantly too. Then we go to the discussion of our study. Previous evidence revealed increasing level of O-GlcNAc and OGT in various diseases, so including cancers. For example, the study by Ma et al. In 2013 show higher O-GlcNAc and OGT levels, but downregulation expression of OGA in pancreatic cancerous tissue when compared with normal tissue. Then in 2012, Lynch et al. Showed that O-GlcNAc and OGT levels were higher in the prostate cancer cells when compared with the normal cell line. Also, Pumak et al. Reviewed that inhibition of O-GlcNAc might be a therapeutic target for cholangiocarcinoma, while the OGT expression level might also helpful prognostic indicator for this cholangiocarcinoma. Many studies have shown correlation between O-GlcNAc and successful postoperative chemotherapy for cancers. For example, in 2018, the study by Joe et al. Showed that O-GlcNAc and OGT levels were significantly lower in chemo-resistant ovarian cancer than in chemosensitive cancer. Also, Liu et al. Reviewed that increased activation of O-GlcNAc through the HPP result in resistance and survival during chemotherapy. From this study, we reviewed significant reduction of O-GlcNAc was recorded in postoperative chemotherapy tumors associated with tendency of low OGT expression but high OGA expression. Related to my previous study that OGT level was significantly associated with chemo response in stage 2B osteosarcoma patient and higher in patients who poorly respond to chemotherapy compared to good responder. Finally, we move to the conclusion of this topic. Modification of O-GlcNAc plays an important role in postoperative chemotherapy for many cancers, but information is still lacking in postoperative chemotherapy called osteosarcoma. we suggest that modification of O-GlcNAc in poor responder osteosarcoma might further reveal its role in osteosarcoma and cancer cell chemoresistance. I would like to give a special thanks for our support, Dr. Charles Konachat, Musculoskeletal Science and Translation Research Center, Department of Orthopedic Faculty of the Medicine, Chiang Mai University, Oral Center and Excellence in Oral and Maxillofacial Biology, Faculty of Dentistry, Chiang Mai University, Oral Surgery and Maxillofacial Clinic, Department of Oral and Maxillofacial Surgery, Faculty of Dentistry, Chiang Mai University, Thailand. Reference. Thank you very much for your kind attention.
Thank you so much, Dr. Siwakorn, for the interesting presentation. Is there any question from the floor? Is there any question or recommendation? Well, I have some question because you said that you collect 20 specimens from the patient with osteosarcoma, but you mentioned in the paper that you record all the data staging of the cancer. Can you please explain that? Is there any relation between the staging of patient and your result?
All of my number of the patient almost in osteosarcoma usually in stage 2B. That means patient usually have a symptom. Yes. In imaging classification, we classify in A, B, C, depend on the type of the lesion and the clinical of the patient. And almost of the patient we recognize in stage 2B imaging classification. Yes.
Okay.
And,
okay, thank you. And one more question. And you studied about 3 biomarker about cancer.
Yes. Yes.
The O-GlcNAc, OGA, and OGT.
Yes.
So from your review and your discussion, there are different type of cancer may acting differently.
Yes.
So about osteosarcoma, so you think which one is the most has potential to be a useful biomarker for osteosarcoma? From
our current knowledge, we usually see that OGT has the most related to osteosarcoma from our study now. But because our study is a global protein study, it's not specific to the protein that represent to the genes of the metastasis or the gene that's resistant to the chemotherapy. So we will suggest that for the further study, we should study in the specific protein. But from our knowledge nowadays in osteosarcoma, every study refer to the OGT expression. That may be a prognostic marker for the osteosarcoma. Yeah, thank you.
Okay, thank you so much. So if there are no other comments or questions, I will move to the next topic. Thank you so much, Dr. Siwakorn.
Thank you very much.
Let's move on to the second presentation